is a perennial herb. The name ginseng comes from the Chinese words Ginseng, meaning man herb, because of the shape of the root. Panax, the genus of ginseng, means all healing. Ginseng is an adaptogen, meaning it is an herb that maintains health by increasing the body's ability to adapt to environmental and internal stress. There are many varieties of ginseng. However, Siberian ginseng is not true ginseng, but is a related plant. And wild red American desert ginseng is a ginseng imposter. It's a plant native to America called Conagra or Rumex. Ginsenosides are the active ingredients of the ginseng plant. Proportions of ginsenosides vary depending on the variety of ginseng. Thus, different varieties will cause different responses. The root of the plant genus, Panax, contains saponin complexes, which are divided into two groups of ginsenosides, the RB1 group and the RG1 group. The RB1 group is characterized by the presence of protopanaxidyl. The RG1 group is characterized by the presence of protopanaxitryl. Ginseng claims to treat or prevent many common medical conditions such as the ones listed. The following information is based on case studies related to ginseng. One study in the American Journal of Chinese Medicine performed experiments on pathogen-free mice, intraperitoneally injecting them with various doses of ginseng extract. The results indicated that by injecting mice with ginseng, it significantly elevated serum levels of immunoglobulin M, G, and A, as well as increasing cytokine production by as much as 50%. However, this study also found that oral administration of ginseng had little to no effect on either immunoglobulin or cytokine production. A present study in the American Journal of Chinese Medicine sought to evaluate the effects of American ginseng on pancreatic beta cells. This study showed that American ginseng may help to increase the insulin secretions from cells, therefore having a hypoglycemic effect. Research published in the American Journal of Epidemiology involved a population-based observational study of 1,455 breast cancer patients in Shanghai who either used ginseng before breast cancer diagnosis or started taking ginseng after diagnosis. These patients took either red or white Asian ginseng or American ginseng. These patients appeared to benefit from the use of ginseng as they tended to have higher survival rates. The lead researcher on this study is from the Vanderbilt Ingram Cancer Center. Chronic inflammation has been linked as a contributor of cancer through extensive laboratory and clinical evidence. Research presented in the Journal of Nutrition shows that ginseng may inhibit the inflammation to cancer sequence, conducive in stopping inflammatory-mediated carcinogenesis. Some of the cancers shown to decrease significantly with ginseng use include cancers of the pharynx, stomach, liver, pancreas, and colon. Currently, the National Center for Complementary and Alternative Medicine is committing $6 million to a 5-year study of the cancer-fighting properties of American ginseng. Korean red ginseng is used as a treatment for cognitive impairment in the treatment of Alzheimer's disease. 61 patients ages 50 to 80 years old diagnosed with Alzheimer's participated in a study that showed Korean red ginseng is a good alternative therapy in the treatment of Alzheimer's disease. Erectile dysfunction affects 30 to 50% of men between the ages of 40 and 70. Risk factors include those who are smokers, are obese, and those with an increase in age. Ginseng was classified into 3 types: fresh, white ginseng, and red ginseng. Red ginseng was found to be more effective in treating erectile dysfunction when compared to a placebo. All case studies reported have stated in their conclusions that further research, studies, and testing may be required. One case study specifically states the following: although ginseng has been used in Eastern Asian countries for more than 1,000 years, the biological activity, pharmacological effect, and its active ingredients remain to be determined. Evidence from the controlled clinical trials did not support the use of ginseng to treat its established indications. Furthermore, the way to prepare ginseng extract, The dosage, the route of administration, and the protocol of treatment can indeed affect the efficacy of ginseng. Therefore, more studies are needed to establish the critical parameters. There are several adverse reactions or side effects associated with the use of ginseng. Always talk with your doctor before starting any herbal supplement. There may be contraindications in regard to medications that you may already be taking or with any current medical condition you may have. Medication interactions include hypoglycemic agents, antiplatelet agents, anticoagulants, NSAIDs, MAOI inhibitors, corticosteroids, and caffeine. Medical conditions include cardiovascular disease, hypertension or hypotension, diabetes mellitus. Miscellaneous cautions include the possibility of ginseng abuse syndrome. To prevent ginseng abuse syndrome, limit use to 3 weeks and do not take for prolonged periods at high doses. The bottom line is that herbal supplements, including ginseng, are not approved by the FDA, the Food and Drug Administration. Why? Because most herbal supplements made for over-the-counter use, like ginseng, vary in their potency and purity. While current studies are promising, further research is required. There is no solid guarantee of the safety and effectiveness of herbs such as ginseng.